Durbin.
Thanks very much, Chairman Grassley. If charges were leveled against the members of the United States Senate and they were accused of legislating, there's no evidence to show it. This is our 5th month of session this year. We've had 5 bills on the floor of the Senate. 5. I want to thank Chairman Grassley for this hearing. This is a bipartisan issue. This is one where Democrats and Republicans, through your leadership, Mr. Chairman, and others, can really bring a measure to the floor that Americans give a damn about: the high cost of prescription drugs. It's a real worry for people as to how they're going to pay for the things that they need to keep themselves healthy and to avoid some terrible outcomes. People in the United States pay the highest prescription drug prices in the world, the highest in the world. On average, 4 times more than people in similar countries pay for brand name medications. 4 times. Democrats took the first step to address this issue 3 years ago by passing the Inflation Reduction Act. It wasn't popular on that side of the aisle, but we passed it. Among other things, this law capped the price of insulin at $35 a month. It set a $2,000 limit on annual out-of-pocket expenses for seniors, $2,000 a year. Still a lot of money for a person on a limited income, but at least it's a figure that they can think about and budget for. And it led the executive branch negotiate with Big Pharma to lower prices under Medicare, something President Biden used to reduce selected drug prices by up to 79%. All that without a single vote from the other side of the aisle. But between those critical reforms, there's much more work we can do on a bipartisan basis. Wouldn't it be something if we announced we're going to take 1 whole week and invite all the good bills you've mentioned and others to come to the floor? Let's debate them and vote them up or down, almost like legislating. One place to start: Big Pharma spends billions of dollars to flood the airwaves with ads. You can't miss them. Patients tell their doctors they need drugs that they can hardly pronounce. Xarelto, congratulations, America, for being able to pronounce the name of that drug, so they can go skiing, golfing, and whitewater rafting. I'm looking forward to it. Only one other developed country in the world permits these outrageous ads that fuel demand for high-cost drugs. You know what it is: New Zealand. Chairman Grassley and I have a simple bill to require direct-to-consumer drug ads to disclose the price charged by the drug company. That's basic transparency to inform America. And it's been supported by President Trump and the Vice President as well. Well, we ought to pass it this year. Another area in need of reform is the topic of today's hearing: pharmacy benefit managers, or PBMs. Take any American at random on the street and ask him what the hell a PBM is. Do they make the drugs? No. Do they prescribe the drugs? No. But they're a key part of pricing those drugs in America. They're the service middlemen that extract colossal profits from patients, doctors, and pharmacies. The big 3 PBMs, CVS Caremark, Express Scripts, and OptumRx, dominate the market, control the flow of prescriptions for more than 200 million Americans, and people on the street couldn't even identify who they are. Over the years, several large insurers, PBMs, and pharmacies have merged, creating vast conglomerates that ignore conflicts of interest at the expense of the patient's pocketbook and health. They engage in self-dealing to steer patients to a PBM's preferred pharmacy, and they squeeze out small rural pharmacies, not just in Iowa, but Illinois too, with low-ball payments. PBMs also abuse rebates and fees to manipulate their formularies, ensuring that they, not the doctors, decide which drugs patients receive. Have you ever had your cancer treatment delayed while you waited for prior authorization on your medication? Thank a PBM. Have you been told you've reached a limit for the EpiPens you rely on to keep your child safe? Thank a PBM. So who is the cop on the beat? Isn't there a federal agency that can address these abuses? As it turns out, there is. It's called the Federal Trade Commission, and under the last chairman, they led the effort to investigate these abusive practices. The FTC even filed suit against the big 3 PBMs for their anti-competitive and unfair practices on insulin pricing. But in a brazen and plainly illegal move, I'm afraid this administration fired the 2 Democratic commissioners that stopped the progress of this case. If this committee cares about addressing PBM abuses that make prescription drugs unaffordable, then every member should speak out against these illegal firings. But enforcement's not the only answer. We need legislation. We need a legislative solution to address these tactics by PBMs. Better yet, we need a bipartisan, broad support for it. Congress came together, House and Senate, Democrats and Republicans, to craft a package to reform the PBM industry. Who would stop such a package? Reform of PBMs, finally getting control of prices. Elon Musk. Last December, hours before a vote on this PBM agreement as part of the year-end continuing resolution, Elon Musk, with his chainsaw, unleashed a barrage of tweets opposing the package. The House Republicans caved. That was it. Relief for the struggling independent pharmacy in rural Illinois or rural Iowa was delayed because the world's richest man didn't like the bill. Never mind that 5 days after tanking PBM reform, health policy expert Elon Musk tweeted, "What is a pharmacy benefit manager?" That was his tweet. I hope today's hearing builds on the bipartisan package of patent and competition reform bills we advanced earlier this year. But if we want to deliver real relief at the pharmacy counter, it's going to require Republicans and Democrats to stand up to Elon Musk and his chainsaw looking to cut anything in sight. I want to thank the chairman for calling this hearing. The turnout shows the level of interest. It also shows an opportunity for Republicans in the majority and Democrats in the minority to finally get down to work and legislate. Thank you, Mr. Chairman.
Yeah.